advanced neural networks. And of course, as like the machine learning, because machine learning includes not only neural networks, but also it includes different techniques like, for example, decision trees or maybe support vector machines and other learning algorithms like Bayesian learning and other things. Of course, it's not now clear that if there will be different types of techniques for deep learning out of the neural network formation, but for now we just have some advanced forms of neural networks in order to define deep learning side. But in the next period, I believe that there will be more different formations of different tools, different algorithms, which can be dealing with the big data, and which means it's a member, or they will be a member of the deep learning. And when we talk about difference between machine learning and deep learning, we can say that machine learning always needed for especially advanced real-world problems, always needed some pre-processing steps to make the data better structured for better learning for the machine learning. But when we come to deep learning, you will not be needing to apply pre-processing because, for example, by thinking about CNN, convolutional neural networks, there are some specific advanced layers which are able to deal with pre-processing side of the data. So you will not be needing, if you use such deep learning algorithms or techniques or neural network formations, you will not be needing to apply pre-processing. But of course, you can apply some image processing steps in order to make the maybe two level of pre-processing out of the deep learning structure. You are free to use data processing, but as default, the main difference between deep learning and machine learning is just you are not needing some pre-processing steps or algorithms or some pre-processing efforts to deal with the big data, because the deep learning techniques are making that for you. And another different thing is that by considering the neural network formation, deep learning techniques just include some layers in the form of the neural networks, some layers which are just having some different responsibilities and different structured logical structures, logical algorithmic structures, and mathematical and logically structured algorithms inside them in order to deal with the big and complex amount of data. But when you think about, for example, default neural networks, maybe multi-layer perceptron model, you just have input layer and some hidden layers and output layers. But when you come to deep learning, you just have some layers which are structured differently according to their how can I say, responsibilities to deal with the exact data. Some of them just apply some pre-processing, some of them just apply some additional steps to maybe lower the height dimension of the data which was just pre-processed already maybe, and at the end you just reach to some fully connected layer which are very similar to the machine learning based multi-layer perceptron, and you just reach to the exact solution and better solution in terms of big and complex amount of data when you compare deep learning techniques with the machine learning. And of course, I've just talked about them. You just apply some training, testing, and application phases to deal with the data. But problem modeling is always a problem, and also training issues are very important problems because you should be selecting the accurate parameters and also data maybe to deal with the problem and reach to desired outputs. So these are very important things. And also that's very important which technique or parameters to apply and to deal with to reach to desired outcomes. And these are always these will be always important problems in terms of machine learning and deep learning, not just including the cancer diagnosis, but for every types of problems, you will be always dealing with such problems. But I will give a better view at the near to end of my presentation at the talking about open problems or suggestions, so I will be better and detailed talking about them. And when we come to cancer, when we come to talk about cancer, we can say that it's an uncontrolled proliferation of cells. It's a maybe official definition and brief definition for defining the cancer diagnosis. And we can say that it's a serious and fatal disease, as you know, and a worldwide disease with 13% of all deaths. That's very important. And it's seen in different organs like brain, tumors, brain cancer, also, we should be having careful screening for reaching to desired treatments objectives at the end. And in terms of computation approach, we can say that the cancer needs good data to deal with AI and to run effective solutions of AI and machine learning to reach to desired outcomes. And also you should be having an effective process of the data, and you should be having a computer supported analyze in order to run some computational approach for cancer. And also you should be modeling your problem for the intelligent systems in order to deal with cancer or in order to run effective cancer diagnosis in terms of deep learning. And when we talk about cancer detection, we can say that it has some different tests in order to see if you or if the target patient have positive or negative cancer. You can be just running load tests in the laboratories, or you can be run some biopsies for cell tests. You can be just making some physical controls tests to detect if there are some nodules or other things which are showing the existence of the cancer. And also you can be running some imaging technologies in order to see inside of the organs to understand if the organs has cancer or not. And when we talk about imaging, we can say that there are different types of approach. For example, you can run transmission or reflection or emission based approach to perform some imaging over specific organs, and you can run CT or X-ray or bone tests or PET tests, and also you can run ultrasound or MR, of course, in order to understand if the target organs have cancer positive or not. But at the end, when you run these, you just gain some data to run the cancer diagnosis for talking about the machine learning or deep learning. When we take the machine learning or deep learning instead of the physicians, for example, or doctor, you just run some data-based feature extraction maybe, or are using deep learning, you may not be needing that reprocessing step, as I've said before. And after using the appropriate data, maybe they can be an image data or other raw data maybe, you just run some training and testing phase, and after your system can be having successful against the data, you just run application, and you may be, of course, supporting the physician, or maybe just using directly in order to diagnose the cancer briefly. And when we talk about deep learning, by considering the current state literature, we can say that there are different types of cancer types learning are widely applied. For example, there is the breast cancer, there is the lung cancer, there are brain tumors, brain cancer, and there are also skin, cervical, liver, and prostate cancers, which are widely researched by deep learning side. You just we can say that you are able to use some data in order to diagnose such cancer types according to the different organs. But of course, when you have a deep analysis for the literature, you can be reaching to different more organs, but the most or the majority of the organs and the most popular ones are now among or all of these organs are among the most popular ones when we consider